Well, hello, friends. And here we are with another installment of Kidney Talks with the Ron and Joy Paul Kidney Center at the George Washington University. I am one of your co hosts, Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church in Southeast Washington, D.C., Ward 7. And we also have with us uh, Dr. Clive Callender, who is with the Minority Organ Tissue Transplant Education Program, known as MOTEP. And our other co-host is Dr. Joseph Keith Melanson with the Ron and Joy Paul Kidney Center at George Washington University. I am so grateful that you're here, and we are looking for an outstanding show today from Dr. Michelle Gaskins Craig, who will give us a talk on scheduling your physical exam and learning your numbers. A brief introduction with Dr. Gaskins Craig is that she's one of the most sought after and best known doctors in Washington, D.C. She's a graduate of Howard University College of Medicine and has been affiliated with Providence Hospital. Her aim is to develop compassionate care and the best medical services to all of her patients. She performs echocardiograms, nutrition therapy, wound care, and venipuncture. Um, and she's also one who uses the state-of-art technology in many of her treatments. Also, Dr. Michelle Gaskins Craig is also fluent in German. So we welcome her today as she speaks on uh, scheduling your physical exam and learning your numbers. And I'll say, wie geht's? Michelle Craig, guten Tag.
Oh,
Es geht mir gut oder es geht mir schlecht?
oh my God. Look, first of all, Reverend Curry, thank you for that introduction. You made me sound really, really good. I was like, who is he talking about?
Well,
Who
bless
is
you.
she? Who is she? But thank you so much. I'm honored to be asked to do the presentation. I give Dr. Callender a hard time, but I love him. He is responsible for me being one of the physicians that I am today because I was educated at Howard University and he beat me up, but it was worth every bruise as I went kicking and screaming down the hall. Okay. Seriously, I'm so grateful for my education at Howard. And I want to say this, I'm a military brat. So my dad was in the Air Force and I started kindergarten in the Philippines at the age of 5. And I was in middle school in Germany. And so, in the military, you learn the language. Wherever you go, you learn the language. It's unfortunate that people come to the United States and they don't have that same type of encouragement, but we learned the language. And so I was fluent in German when I was in Germany. I'm 62 years old now, and I don't know how much of it I remember. But when I went to medical school, my preceptor was Dr. Ovid Trauth. And I walked into Dr. Trauth's office and I looked on his bookshelves and I saw all these German books. And I said, why do you have so many German books on your shelf? And he said, how do you know they're German? And I said, because I was in middle school in Germany, so I recognized some of the words. And Dr. Trauth said, from now on, when you come in my office, we will not speak English. We will speak German. So that was amazing. So the whole time I was in medical school, I was only allowed to communicate with Dr. Trauth in German. So I picked it up a little bit again.
Well, good.
So I'm just telling you, my instructors at Howard are amazing people. So again, thank you for the invitation. And one of the reasons why I was so excited about talking about getting your physical and knowing your numbers is because it's one of the things that we take for granted. Like people get a physical every year, but I've learned in the population that I take care of that they don't. They actually come to the doctor when something is wrong. When something hurts, when something is about to fall off, when something is broken. And especially my female patients, because they're nurturers and they're caregivers. And so they make sure everybody else is okay, but they don't always come and make sure that they're okay. And so I want to encourage everybody listening, get your physical and learn your numbers, because a lot of the things that are killing us, heart disease, kidney disease, diabetes, we have no symptoms from. So people think, oh, well, if I feel bad, I'll go to the doctor. You don't feel bad all the time. You get sick and you go downhill. And sometimes by the time you do have symptoms and you come see me, sometimes it's not a lot that I can do about it. So I want to say, first of all, that I am a diabetic. I am hypertensive. I have high cholesterol. And I take meds for all three because I don't want to go out like the people in my family. My mom passed away last year from a stroke. My oldest brother, who's a year younger than me, died from a heart attack sitting in his car at work on a break. My oldest sister was born with a hole in her heart. And when she had surgery, she had a stroke on the table. Now, remember, that was 60 years ago. So now things are more advanced. But at that time, she actually had open heart surgery to close the hole. And she had a stroke and she died. So I'm preaching to the choir, as they say, because I too used to be one of those people. I felt okay. I worked and took care of people, but I didn't necessarily take care of myself. So I want to encourage you, don't be like I was. Because if you go get a physical, you have insurance. It's a routine thing. Your insurance will pay for it. If you don't have insurance, there's free clinics and places that you can go and still get a physical. And when you get your physical, it is standard and routine to have blood work done. And one of the things that you will get done is your blood pressure. That's one of the numbers that you need to know. Your blood pressure. What is your blood pressure? Another number you need to know is your cholesterol, because a bad cholesterol can clog up the works and cause a lot of problems. Another number that you need to know is your blood sugar, or specifically your A1C, to find out if you have diabetes. If it runs in your family, it's even more important for you to get that checked. And then two other important numbers for me would be your creatinine and your BUN. Those are kidney functions, because again, you don't always feel anything at all when your kidney functions are out of whack. You might not feel anything at all when your cholesterol is high. You might not feel anything at all when your blood sugar is high. And you might not feel anything at all when your blood pressure is high. Blood pressure is actually nicknamed the silent killer, because no symptoms, but it can be out of whack and you'll have a stroke, a heart attack, and not know it. So those are the ones I like to concentrate on. Blood pressure. Everybody is not a physician, so they might not know exactly what I'm talking about. But your blood pressure, patients always ask me when they do those numbers, which one is more important, Dr. Craig, the top number or the bottom number? And so I always tell them that they're equally important, because I don't know if you guys can see. I tried to draw a picture. I tried to draw a picture on my dry erase board. I don't know if you can see it. Can you see it? You can't see it. But
I can see the heart.
Okay,
so the lungs.
Right, it's the heart, the lungs, and underneath at the bottom is a muscle. It's an arm like this put up to the muscle.
Okay.
So I always like to tell people when I do my presentations that that's the circle of life right there. The heart, the lungs, and the body, your muscle. That's the circle of life. That's the circle of life. And all of the numbers that we're talking about today affect that circle of life. And so I love to say that the heart, the most important muscle in your body, squeezes the blood to every muscle, every tissue in the body. And that's the gas that make you go. And then once you use all the gas and all the gas is gone out the tank, the veins, which look blue because all the oxygen is gone, takes the blood back to the lungs, picks up a good fresh supply of oxygen and dumps it in the heart so the heart can do its thing all over again. So every single disease that we're talking about today affects that circle of life. So those are the important things: the heart to the muscles to the lung to the heart, and the cycle goes on and on and on. As long as you're healthy, that will continue. But here's the problem. Blood pressure. When your blood pressure is too high, your heart can't be an effective pump. So I always like to think of my heart is about the size of my own fist. And most people's heart is the size of their fist. And it's in the left side of your chest. And I always, when I talk to my patients, I always do this. I say, your heart fills up and then it pumps. It fills up and then it pumps. So the bottom number of your blood pressure kind of represents that filling time. The bottom number. Your heart has to have enough time to fill up with gas. Otherwise, when it pumps, there's nothing going to the muscles or the tissues, right? So I always do that. I said, so this is what your heart does. It's the size of your fist and it fills up, boom, fills up, boom, right? And it shoots. And so if the bottom number is too high, that means your heart doesn't have enough time to collect this oxygen-rich blood from your lung. So when it pumps, it's not sending anything to the tissue. So then what happens is it'll pump faster, trying to get more blood to where it's supposed to go, right? But still, it's not giving you enough. It's not boom. It need to fill, boom. It need to fill and go. So this motion, filling, beating, filling, beating, should happen about 60 to 100 times in a minute. But if you're not filling up enough, you're not taking up enough time to fill up, you're going to fire off way too many times. And so you'll fire more than 100 beats a minute and you'll get exhausted. The other thing with the top number, that tells me how effective my heart is when it pumps, how effective it is as a pump, right? If that number is too high, if that pressure is too high, your heart has to work against a high pressure. So instead of it just having an easy job of filling, I'm pumping 60 times in a minute. Now it got to work hard to squeeze because it's working against a pressure that's high in the blood vessels. And anytime you have to work harder, your muscles kind of bulk up a little bit. They get thicker because they're trying to get the job done. If they have to squeeze against a higher pressure, and they gotta work at it. Now they get thicker and it gets bigger. A little bit of thickness, a little bit of bulk is okay. But when it gets to the point when it's too big and it's too thick, now it's not doing that smooth motion, filling, beating, filling, beating. Instead, it's filling and it might quiver, or it might, as we say, fibrillate. It's an ineffective beat. So now it's straining and it's thick and it's big and it's boggy. What happens then is the blood that it collects is not pumping it to the body because it's too thick and it's too ineffective as a pump. And so it backs up and goes the other way. And when I just showed you the picture of the circle of life, that means it's going back to your lung. It's not supposed to go back to the lung. It's supposed to go from lung to heart to the body. But now it's too thick, the pump. And so blood backs up and goes the other way. When I see a patient and that happens to them, I'll try to lay them down on the table to examine them. And they feel like they're drowning in their own blood. They can't breathe. Dr. Craig, can you leave the table up a little bit? Because I can't. And that's exactly what's happening. They're drowning. They're suffocating in their own blood because now the heart is damaged, it's thick, it's big. You might hear the term congestive heart failure because now the heart is failing. It can't be an effective pump. Blood goes back to the lung and now they can't breathe. And if this cycle continues, blood goes back even further into the veins. Remember, we had the veins taking blood to the heart, to the lung, and then the lung to the heart. It backs up in the lung. It backs up in your veins. And now you look at the person and they have swollen ankles, cankles, big old ankles that are swollen. Now they have to wear support hose. It's all related. I'm giving you news that you can use. We got to control the blood pressure so that doesn't happen, because you don't reverse congestive heart failure. Once your heart is big and boggy, it's big and it's boggy and it's ineffective. I can put you on certain medications, but you won't recover that nice, beautiful, healthy structure of a heart. So that's one of the numbers you need to know, your blood pressure. We need to keep the bottom number low so you can take time and fill. We need to keep the top number low so You can squeeze to the rest of the body. So I like to always use graphic demonstrations like that because that makes sense, right? That makes sense. The other number that's important to me is cholesterol. And cholesterol, people always say, well, you can't help it. If your mom's cholesterol is high and your daddy's cholesterol is high and your grandmammy's cholesterol is high, you'll probably have high cholesterol. That's not true. You have high cholesterol usually because of what you eat. Now, it is true that a part of your blood pressure, there is a component of cholesterol that can come from family. But look, you can't control who your people are. You can't control that. But what you can control is what you put in your mouth. So I was shocked the other day while I was researching this to talk to you guys. And I realized that your liver makes all the cholesterol that you need. If you never eat anything with cholesterol in it ever, your liver makes all the cholesterol that you need. And cholesterol is not a bad thing because cholesterol helps to construct the membranes that surround every single cell. So you have to have separation of the cells so they can do their function. The liver cells can't mix with the kidney cells. The cholesterol actually is the sterol that's in the cell membrane. So you need cholesterol and your liver makes it. But when you eat, let's say red meat, a steak, or ground beef, and you take in cholesterol, you might take in that bad cholesterol that we call it the LDL that you cannot use, right? And so now if you collect bad cholesterol from your diet, from things that you eat, you will clog up the works. Back to my beautiful, beautiful graphic. So the blood vessels that carry, let me move this way, that carry blood to the heart and from the tissues, they'll get cholesterol buildup. Another thing that affects the circle of life. So now the heart doesn't only have to fill and pump, it's got to pump blood past those cholesterol plaques that's all in your blood vessels in order to get to the tissue, in order to get to the muscle. So we need to keep the roadways clear. You don't need to pile them up with cholesterol and fats. So again, you have to control what you put in your mouth. So when you go to the doctor and you get your physical, you get your blood pressure, you got to know what your cholesterol is so we can control that so that we don't clog the works. The other number that's important to me is blood sugar or hemoglobin A1C. Fancy word. It's a blood sugar that tells me for 3 months how well your blood sugar is controlled. And if you have diabetes, again, people always say you get diabetes. Everybody in my family have diabetes, so I got diabetes, right? That is the case in my family. My mom and my dad were insulin dependent diabetics. But when I got to medical school and I found out that the way I eat is a learned behavior. I eat the way I eat because that's the way my mother taught me to eat, and my father taught me to eat, and my aunts and my grandparents taught me to eat. So I eat the way they eat, right? So I unlearned that when I got to medical school. I was like, what? You mean to tell me that I actually could stop this diabetes thing? So here's the ticket. I can't choose again. I can't choose who my people are. I can't, but I can change what I put in my mouth. So when I got to medical school and realized that my maternal grandparents, my mom and my dad had diabetes because of the choices that they made eating, we from Rocky Mount, North Carolina. We like our chitlins. We like our peach cobbler. We like our pineapple upside down cake and pork chops and gravy and all of that, right? But the key is doing things in moderation. Dr. Craig still will eat a pork chop, a fried pork chop, and put it over a bed of rice with some gravy in a heartbeat. But it's not something that I do every day. It might be a treat. Holidays, Thanksgiving, but I stopped eating it every weekend the way my family used to have those big family dinners on Sunday, and we would eat macaroni and cheese and greens with ham hocks in it every Sunday. Okay. So I stopped doing it every Sunday, and just do it sometimes. And then I increased the vegetable content in my diet. And this is what happened. When I turned 51 years old, I got diagnosed with high blood pressure and diabetes. I got diagnosed with high blood pressure when I was at a GYN visit having a pap smear. Dr. Medjib Mayer took my blood pressure and she said, "Is your blood pressure always 150 over 90?" And I said, And she said, "Okay, well, do you want me to write the lisinopril or do you?" So at the age of 51, I got diagnosed with high blood pressure. Later on that year, I had my physical and I got diagnosed with diabetes. Dr. Metassini said, "You have crossed the street to the other side. Your A1C is 6.6." And I started crying. And Dr. Metassini said, "Really, Dr. Craig, your mother's diabetic, your father's diabetic, grandmother, brother." And so I still kept crying. And so you know what he said to make me feel better? He said, "Well, Dr. Craig, at least you don't need insulin." He said, "Your mom's on insulin, your dad, everybody in my family is insulin dependent except me. And I'm 62. And it's 10 years later, 11 years later than when I got diagnosed, and I still don't take insulin." So I'm looking at the glass like it's half full instead of half empty. Because no matter when you make a change, no matter when it is, it's not too late to do better. So that's another one of your numbers that you need to know, your hemoglobin A1C. Because diabetes affects that circle of life, the circle of life that I always keep showing you. The thing is, the body was created to be an alkaline organ in general. So what do I mean by that? When you talk about the pH, the acidity of all the organs in the body, they should be towards the high end of the scale. They should be alkaline. The only acidic organ that we should have is our stomach. That's the only place where it's okay for it to be acid all the time. Well, actually not there either all the time, because you'll get acid reflux really, really bad. But the acid in the stomach helps to digest your food. But all the rest of the organs in the body should be alkaline. People who have uncontrolled diabetes have acidic organs. And you can even go into a condition called ketoacidosis that could kill you. So you got to know your numbers. All of these numbers, your cholesterol, that can clog up the works. Your blood pressure can cause you to have congestive heart failure and myopathies. And diabetes can cause you to go into acidosis and destroy that circle of life. Everything affects the circle of life. Kidney function is another one of those things that you will never have symptoms from until usually it's too late to do something about it. And your kidney numbers are BUN, which stands for blood, urea, and nitrogen. And your liver makes urea. It's one of your waste products. If you have uncontrolled BUN, then you make too much urea. And that's going to, again, mess with that circle of life, and it can destroy your kidneys. Your creatinine. So the numbers that I want you to learn, blood pressure, cholesterol, sugar, BUN, creatinine. And I know some of the other providers here can elaborate more on kidney function, but I just think that that's odd that all of those things you might not have any symptoms at all from until something happens that's not good. So you got to get your physical. Come see me, go see your primary care, go see somebody. Get your physical, get your blood pressure taken, get your blood work done, and know those numbers so we can normalize them so that you won't destroy the circle of life. That's all I really wanted to say.
Well, thank you so very much, Dr. Craig. We are so grateful for your sharing. And I would just like to encourage those who are joining us from around the country to put your questions in the chat. And I know I have questions upon question, and I know Dr. Melanson, who has joined us, thank you, as well as Dr. Callender, also have questions that we want to really ask you. I want to jump in and ask you, since you're a person of faith, I want to jump in and ask you, as people of faith, how do we learn to change our habits and behaviors? Because that has to be some important, that has to be an important feature with regard to shifting what we do in terms of even how we eat. If we are to know better and do better, especially as a person of faith, um, we are, I like to know what your perspective is as it relates to how can we do better as people of faith by having this information and knowing better.
That's such a good question, Reverend Curry. I said the other day, so I do have patients who come to me, and you have to be careful who you, as a physician, when you talk
Sure.
about
Sure.
your faith, what you believe. But patients know that I am a woman of faith, and they know that I direct the choir at church, and they know that I like to sing and stuff. So I love when they ask me about faith. And so it's a scripture that I love using. And I think it's First Corinthians. I had written it down, First Corinthians 6:9. But it's the scripture that says, know you not that your body is not your own, but that it's the temple of God. And it doesn't belong to you. It was bought with a price, and so you belong to Christ. So if you also are people of faith, it is actually a sin and a shame not to care for the temple of God. And if we are people of faith, Christians in particular, and we believe that Christ died for us, if he made that sacrifice for us, the least we can do is take care of the temple that he gave us to be good stewards of. So I hit him from that angle, right?
Okay.
And I
Okay.
say, so now I feel like
I love it.
it's a sin for me not to be a good steward over this wonderful body that he gave me. And so I can teach you how to do better. And one of the things I love to do is have them write a food diary. I always say for the next 2 weeks, I want you to write down everything that you eat. And don't write down what you think I want you to write and the good stuff that I want to hear about, the apples and the pears. And I said, write what you really eat. I don't care if it's chitlins, if it's pig feet, whatever it is. Write it
Be
down.
honest, Tom.
Be honest. And then when they come in, sometimes I can help them figure out some things that they can substitute that they'll enjoy. One thing that I know, because it's true with me, I'm not eating something if it don't taste good. Dr. Craig, not doing it, not doing it. And I don't expect other people to do it either. So there are plenty of foods that we can eat that taste good, that'll help us. So one example I want to give is I went to my primary care and she made me do that same exercise. And so when she looked at my food diary, she said, Dr. Craig, one of your go-to foods is salad. She said, I noticed that you eat a salad 2 or 3 times a week, from my food diary. And so a salad with chicken on it. I always want to put some type of meat on it. So she said, I thought she was going to say something about the chicken. That's not what she did. She said, what salad dressing do you like using? And without hesitation, I said, anything that's orange. I like French, Thousand Islands, Russian, Catalina. I said, if it's orange, Dr. Craig like it, right? So she said, have you ever paid attention to how many calories are in Thousand Islands or French or Catalina? And then I was like, no. And so she said, let's look. So she Googled it right there. And she said, let's Google Kraft and Wishbone. So we just picked 2 of them and we looked up the calories. And the proper salad should only be dressed with 2 tablespoons of dressing. Okay, you guys, let me tell you now that I'm sure I use at least 4 because I want every leaf in my bowl to be touched by that salad dressing, okay? And that's a bad thing, but that's honest. So she said, okay. So when we looked it up, I think the French dressing from Kraft French dressing has something like 190 calories. And so she said, for 2 tablespoons. So she said, if you do 4 tablespoons, Dr. Craig, you're killing yourself. And then when we looked up Thousand Islands, it was something like 210 and just 2 tablespoons of dressing. So that means I was eating over 400 calories. And then the fat content was ridiculous. So she said a trick of the industry is whenever they say something is fat-free, the salad dressing is fat-free, then it's probably going to have a lot of carbs or a lot of sugar because something got to make it taste good. So if they take out the fat, it's going to have a lot of carbs and a lot of sugar. And if it's light and it's light on carbs and sugar, it's going to have a lot of fat to make it taste good. So now one of the things I encourage patients to do, Reverend Curry, is read the labels, like be a label reader, because it will discourage you if you but most of us don't look at the label. So if you turn over the package and I look, and I had known that I was eating that much fat, I might as well have cut up a fatty marbled steak and just thrown it on the salad. That's what I was doing every time I ate a salad, and I eat a salad 3 or 4 times a week. So now knowledge is power, right? So now that I know that, that turns me off. Well, so she told me to check out Skinny Girl. Bethany Frankel, one of those housewives from whatever, Beverly Hills, has a line of Skinny Girl products. And Skinny Girl, they have 4 different types of salad dressing. Poppy seed, honey mustard, raspberry vinaigrette, and balsamic vinaigrette. So anyway, I went straight across the street from her office to Walmart, and all of them was on the shelf. All 4 flavors. They have Giant, Safeway, they're everywhere, right? And so now 2 tablespoons of any of those is no more than 20 calories, right? So now if I want to put 4 tablespoons on my salad dressing, on my salad, I can and not hurt myself. I'm only getting like 40 calories. So do you know, 2 weeks when I went back later to see her, I lost 7 pounds from changing my salad dressing, because I eat salad all the time, but I was killing myself with the salad dressing. So that's just like one little thing. So besides speaking to them from that spiritual point of view and making them feel bad and feel obligated to take care of their body, then I talk about real things. So let's change the salad dressing. So that's just one example of something that I changed, that helped. Another thing that I substituted was cauliflower. I'm looking at it on top of my refrigerator. Cauliflower rice. I substituted that. But I'm telling you, I don't like the way it tastes by itself. But if I put it with something like, for instance, if I make turkey chili, right? The beans are good. The white beans are excellent source of protein, right? And some other minerals. And then the turkey is better than the red meat, so that I don't get the fat. But I'll put it over cauliflower rice. So I still get that feeling that I'm eating my chili and rice, but I'm cutting out a lot of calories. So there's a lot of things. If they just bring me their food diet, Reverend Curry, I can tell them some other stuff that they can do that tastes good. If it don't taste good, we're not going to even talk about it.
Well, I know, because we could talk about this all day. I do think that you were talking to Dr. Melancon. Being from Louisiana, he eats a lot of a lot of good food. Not saying he can cook anything, but knowing he eats a lot of great food. But we do want to come to him and Dr. Callender very quickly, because we have some folk that are asking some serious questions in the chat. So Dr. Melancon, Dr. Callender.
Well, first of all, Dr. Craig, and first of all, I'm sorry I was a little bit late. I was trying to get this on my phone because
you trying to eat that gumbo. We know. Okay.
That crawfish.
Yes.
Right?
I do love the way you break things down and your circle of life. And it was just point on in explaining that to the lay public, because that's the most important thing. People have to understand in order to be educated, right? And I think for us, for physicians, too often our discussions go above people's heads. And it's just like mumbo jumbo. They don't get it, and therefore they don't follow our directives. So so hats off to you about that.
Thank you.
And then again, you are absolutely correct about food choices. We of various ethnic backgrounds, we love food. We love the way stuff tastes. And just to say this is healthy, this is unhealthy, and the healthy option is like eating tree bark, is not going to get people to change their diet. So it has to be something that they will enjoy eating. Now, I saw Reverend Curry getting hungry when you were talking about those pork chops, but the point is, you've got to give people a good but healthy option. And I've talked about on this show before, and Dr. Curry is right. I love to cook, and I've taken some of those traditional Louisiana foods and I've just changed the recipe around a little bit. Kind of like what you were talking about, like substituting cauliflower rice and things like that. but it can be done. But it all starts with waking the person up to the knowledge, right? Your doctors told you, look at how many calories you're getting from your salad dressing, and that enabled you to decide, all right, I need to make a change. And then you found something that tastes good for the substitution. So I just loved your talk. I think, we don't need anything else other than to reinforce your messaging. And you're right, these are silent killers. Yes. People walk around thinking that they're okay because they're not having pain or they're not having blurred vision or whatever, and they are getting closer and closer to the grave because these are silent killers. You have to know this information, and that's why I love your message. So keep on doing what you're doing. We need more people like you, and keep spreading that message.
Thank you.
Dr. Callender, and I do want to go to some questions, but I will make just a quick comment on Sister Karen Barnett. Says that, Reverend Curry, you can fry turkey chops hard too. Just smother them with onions. So I didn't realize we would have a cooking show today, but this is quite amazing. Dr. Callender, what are your thoughts with regard to this wonderful presentation by Dr. Craig?
Well, I was very, very proud that one of my students would own me, number one, and then exhibit such a wonderful presentation that is so down to earth and right on target to help people do better and live healthier lives. But I don't want to take time away from your chat questions you have in the chat. So
okay,
why don't you proceed?
Well, let's do this. Let's go to Carolyn Tobin, who said, I've been on diuretics since 2018. Now my kidneys have to be watched. Is there any hope for avoiding escalation or escalating? Situation getting worse, I would take it.
Well, all right. So it actually, I can answer that question. The issue is, why is she on diuretics? I presume part of that circle of life that Dr. Craig was talking about is, the heart is connected to the kidney, right?
That's it.
So if you have malfunction in anywhere in that circle, it can manifest in other parts of the circle, right? So people that need to be on diuretics tend to be holding on to fluid. And you tend to hold on to fluid when you remember Dr. Craig talked about congestive heart failure. So her heart needs to get better, most probably, in order for her to more naturally get rid of the fluid without diuretics. Yes, when you're on diuretics for a long, long time, your kidneys must be watched closely, because if you overdo it, then you can hurt the kidneys. That's called pre-renal azotemia. So it's very, very important that if she needs to be on the diuretics, and you can safely take diuretics, but absolutely you got to be under the close watch of a doctor. And I would say even a nephrologist if her creatinine, her kidney numbers are starting to go up. But in addition to the diuretics, diet changes have to happen as well. One of the most important things to avoid is going to be a high salt diet. So that's one of the things that needs to happen in the diet, which will help the use of the swelling and the use of all those diuretics.
She also says she has mitral valve mismatch, and she's on blood thinners.
Yeah. So she has cardiac issues, which is really, really the main issue. But again, she can safely be on diuretics in order to treat her heart, but her kidney function must be watched, and she needs to have either the cardiologist can watch it, but if there's any change in the function of her kidney, she needs to have a kidney doctor.
Yeah. Well, someone else, is asking some questions about one of the things that Dr. Craig spoke of, and that is cholesterol. She didn't go into details of the LDL and the HDL, but there's someone that's asking right now, how do I keep my LDL low? I'm taking rosuvastatin about 10 milligrams right now. But what else do you recommend?
Me?
Yes, ma'am.
So cholesterol laden foods tend to be meats, of course, red meats, but not just red meats, and the skin of the chicken, you know. So again, we have to do those in moderation, but increasing vegetables. If there's any type of vegetables that a person likes to eat, they should eat way more vegetables, the greens, collard greens and kale and broccoli and Brussels sprouts and stuff like that. And then there are other ways too to avoid getting a lot of cholesterol. If there's any type of beans that you like, I made a pot Sunday of field peas. I couldn't find field peas in none of the stores, and so I got them some off Amazon. And so I made some field peas, and I put some smoked turkey tails in there. And then, y'all, I'm showing my country. I'm showing my country. But the turkey tails were good. So I ate the turkey tails, as my meat, and they seasoned my field peas so good. So beans and lentils is another way. I mean, again, things that you like, the vegetables that you like. And, I guess people have been using a lot of smoked turkey and turkey necks and stuff like that to try to avoid using the pork. But you can make your greens and your beans and stuff taste good. So just eat more of the veggies that you like, and the beans are excellent source of protein, and they taste good. The ones that you like.
I think what you're saying is very important, and I think our audience probably needs to hear that, because in American culture, I'll say it that way, we tend to have meat as primary and vegetables as a garnish. What you're suggesting is to switch that.
Yes.
And make the vegetables primary, yes, and our meats a garnish.
Yes.
You know how much behavioral adjustment you're asking folks?
I'm asking. Yep.
But this is for their life's sake,
yes,
right? This is for their livelihood.
Yes.
So I thank you for that. I do want to jump down and ask a quick question and then hear from Dr. Callender. It says, somebody says, this is Antoinette Sims, who says, when you have a small lump on your kidney, is it better to have it removed or don't touch it at all?
Thank you for the question. I think we now know that the size of the lump on your kidney is what matters, because if it's greater than a centimeter or so, then the chance of it becoming a cancer becomes an issue. So that if you do have a lump on your kidney that suggests that that's a tumor, then that can be analyzed, and if they find that it is actually a growth, then it probably should be removed. Now, again, the size of the lump is important. If it's less than a centimeter and it appears as though it's fat or something, then that can stay. But if it's more than a centimeter and it's not fat, then the likelihood is that it could be removed. But your doctor, we now have tools that allow you to look at the lump and tell whether it's a fat or whether it's a solid tumor. And if it's a solid tumor, it likely needs to be removed.
Okay. Well, somebody.
Keith, do you have any suggestion other than that?
Yeah.
No, I thought what you said is absolutely straight on. I mean, you're right. With the imaging of today, the CT scans, MRIs, they can tell pretty well if there is a solid tumor there. And if it's a solid tumor, then and exactly like Dr. Callender said, if it's over like 2 centimeters, it needs to be removed.
Okay. All right. Now, I don't know the fullness of the question, but somebody, I guess, as Dr. Craig was speaking, asked about cornbread, and I guess as it relates to the health that you were speaking about, is it too much or too little, or how shall it be made, or what have you? But cornbread is good for what we used to call, they don't do it anymore, sopping. with those beans and all sorts of other juices that come from the meal itself.
You see, Dr. Craig, and now the Reverend is showing his country.
That's right. Well, it takes country to know country. So,
love it. I love it. And all I want to say about the cornbread is those recipes should not be altered. The way you make your cornbread is the way you make your cornbread. But again, you just got to eat it in moderation. It can't be something that we eat with every single meal. We can't have it with every single meal because some of the things that we put in it is the butter. So again, that cornbread, that's one of those things I think you eat it when the way you fix it. You don't have to change it, but you just should eat it in moderation. This just should be something that we don't do all the time. You know, like we shouldn't have biscuits with every meal. We shouldn't have cornbread with every meal. That's how I feel about that.
And that's absolutely right. You know, I cut back on the bread, but when they bring that bread hot out of at the restaurant or what have you, it's difficult sometimes. Yes. But I do want to come back to Karen Barnett made a great statement, and she said life change in diet is better. I got so many of y'all responding. Life change in diet is better than life changes attached to dialysis, amputation, and related peripheral comorbidities. Pass me the salt-free seasoning.
There you go.
And the modified recipe.
Amen.
I think that sums up a lot of what's being said even right now. And I'm just interested in going just a little bit deeper. You talked about this wonderful cycle of life, and I know in that body part that you're talking about between the lungs and the heart, you have the liver and the kidneys. And you mentioned a lot about blood tests and all of these things. What about urine tests in your experience to help out? Fill out this and complete this whole cycle of life? What role does urine test play?
Dr. Callender, you want to take that one?
You're on mute, sir.
Of course. I'm so happy that you said that, because I think that this is something that I believe every person of color over 50 should have a urine protein test, because that's the earliest manifestation of kidney disease. And what my complaint is that for annual physicals, most people of color are not required to have urine protein analysis. And I think that should change, especially for people over 50 or people of color.
All right.
Dr. Curry, Reverend Curry, I was taught well because, again, Dr. Callender taught me every single patient who I do a physical on, they do urine, and I run the urine analysis in my office. I don't even send it out. I do it right there. So I can tell them before they leave if there's sugar in their urine, if there's ketones, if there's protein, and what some of those things can mean. If their protein is high, I'm concerned about kidney disease. I'm concerned if they have high blood pressure and I have them on blood pressure medicine, sometimes the blood pressure medicine is not enough. I might need to change it because they still spilling protein in their urine. And the same is true with the diabetes. They might have sugar in their urine, but the protein might be because the diabetes is out of control.
Yeah.
So I run it in the office so I can tell them before they walk out the door. That's one of the things that we need to work on. If you will allow me to say this too, this month, October, is breast cancer awareness and domestic violence awareness. And as far as breast cancer is concerned, my male and my female patients, when they get a physical, I do breast exams on my men and my women. Wow. And a lot of people might not know, but I'm a 21-year breast cancer survivor. I had breast cancer when I was at Howard. I got diagnosed when I was 41.
Wow.
And so at the age of 62, I am a 21-year survivor. Grateful to God for that. But that's another big issue with me. I got my pink on today. I don't know if you guys can see my button, but I have my breast cancer. And my collar on my coat has the breast cancer symbol on it. So I'm an advocate for getting mammograms, but just teaching patients how to do a breast exam. Sure. Again, at Howard, I was taught that when people check their own breasts, if they feel lumps that feel like the tip of their nose, that feel like gristle is good. I don't care if they have 100 of those. Those don't bother you. But if it feels like the bridge of the nose, if it's bone hard, that's bad. So it's easy. Gristle is good and bone is bad. So when they check every month, I tell them check every month. And if you feel something that's bone hard, you need to come talk to me or talk to your doctor. Nothing should ever feel bone hard. And when I found my lump, I got out the shower and I felt a marble hard. And I had my biopsy with Dr. DeWitty. Dr. DeWitty did my mastectomy and Dr. Dennis reconstructed me. And so I have 2 beautiful perky boobs now, and they're healthy because I did that breast exam myself the way I was taught at Howard. And thank God, I can say 21 years now, I'm taking care of other people with breast cancer.
Wow.
You know, but Doctor, I gotta respond because first of all, let me show you my pants that I have on. Can you see these?
All right now, yes, I do.
All right, because
I'm
simpatico with the movement. You know,
yes.
All right.
All right. That I am wearing those for breast cancer awareness.
Yes.
And then I also wanted to say that you started by talking about the urine test that you do in your office, and I guarantee you are in the top 5% of primary care physicians in the country, because virtually no one does that. And I've been working with Dr. Callender for years, trying to get this to be more comprehensive in primary care coverage, because not only do they not test the urine, we will test the urine and outreach, send them to the primary care physician, letting them know that the patient has proteinuria or glycosuria, and it's ignored sometimes.
Yep.
So this is hugely problematic. And again, it just goes to show of the superlative care that you are providing. And Dr. Curry, I'm a historian, and in the old days we used to have these gurus, and gurus were so important because of what we see here with the great Dr. Callender, who has taught people the right way to go out and give care to the community. But I am so proud of what you just said, Dr. Craig, because that is so very unusual, and we need more people to do exactly what you're doing.
Thank you.
Well, we definitely need to have this, because the reality is a lot of folk in our community still have their apprehensions about doctors. And it comes from a lot of our history with the medical profession. But thanks be to God for you all who are really helping us to begin to recognize and understand. And see, Dr. Craig, this show is getting all sorts of great ratings, and folks saying it's amazing. I want you to answer a question for Miss Angela Clark Francis, and I need Dr. Callender and Melanson to chime in. She says, I have kidney disease, stage 3, diabetes, high blood pressure, cholesterol, and I'm overweight. Need to know what options I have to get better and healthier. We applaud you for raising this concern in the open, and we have the doctors here that can answer it. All right, doctors, who's going first?
I'll go first because I had the easiest job. I'm gonna say, come get your physical. Come get that physical, and then we'll take them one by one. If the cholesterol is high, if I need to put the patient on medication for that, I can do it. If the diabetes is high, if we need to medicate, we can do it. But we don't always go straight to medication. We like doing weight loss. And instead of me telling patients that they need to lose weight, I help them lose weight, because I'm overweight too. I'm a diabetic too. I have cholesterol too. And it's easier when I know what their struggle is, to lose the weight. We even have places that we recommend where they can go shop, or coupons, because there are some food deserts in our neighborhoods where we live. We might not have places where we can get fruit and where we can get, things like that. So we it's practical information. When you come see me, where do you live? And then we talk about places where you can go shop, or we talk about programs where you can sign up to get food delivered, stuff like that. So we'll attack it one thing at a time. We'll treat the diabetes, we'll treat the high blood pressure, we'll treat the cholesterol, but then we'll start getting healthier temples so that we can lose weight, drink more water. I have my patients drink 8-ounce glasses a day. And they'll say stuff like, I don't like the way water tastes. It don't taste good. Or I feel like it's just hard just to pick up a bottle of water and just drink it. So it used to be for me too. And so one of the things that I do is I have four 16-ounce bottles that sit on top of my desk, right? And so when I look up and I see one of the bottles and I haven't drinking, and it's like, hey, it's 12 o'clock, I haven't drank my water, I'll take a handful of nuts. You can't do it if you're allergic to nuts, but I'm not allergic to nuts. Like I'll take a handful of sunflower seeds or a handful of pistachios. They have the good fat. And I'll throw them in my mouth, and they'll make me so thirsty that I can take out 8 ounces right then. So I eat the nuts right then, and then I take the water. Or I'll have a little pack of Ritz crackers, right? And so when I look and I see that I haven't drank any water today, I'll eat a cracker. And so, soon as you eat it, my tongue and my mouth is so dry, and then I'll take out 8 ounces, easy. So I make myself want the water. I just do something to make myself thirsty. I'll eat a handful of healthy nuts. I'll eat a cracker, one cracker, and then I can drink it. So I don't feel like I'm forcing myself to drink it. I'm thirsty and I'll drink it, right? And so little stuff like that. I'm always practical. I'll tell you, this is what I do to get my water. And then by the end of the day, I drank all 4 of those bottles of water. 8, Reverend Curry, is the number of new beginnings.
There
so
it is.
Said, come on, let's start a new beginning. Let's drink some water.
All right.
Okay. Take it away,
keeping the water going. We definitely need that. But also, let me just pause, because Dr. Melancon thinks he's a star already, and he got acknowledged for his pink pants being on fleek today on the show.
There you go, Dr. Melancon.
But I also want to go back to Miss Barnett's comment. She's throwing some nuggets herself in of things we need to do in the community. She says we must be our own advocates, and this forum does a phenomenal job of making African Americans aware of things they need to do and things they need to advocate for. Dr. Craig, you mentioned food deserts.
Mm-hmm.
One of the core things in my whole life and ministry is really dealing in Southeast Washington, D.C. with social determinants of well-being or health and well-being, to eliminate food deserts, to eliminate issues of public safety, all of those sorts of things that sort of get in us and affect us in ways that will not allow us to have sane mental health, let alone physical health.
Right.
So I just hope that folk are really hearing what you have to say, because we need to make sure that we get all of these vitals together, know our physical, know our numbers. I need you to repeat those things again. We have blood pressure, we have cholesterol. Go down the list, and I want everybody out there to write them down to make sure you get them done, and include your urine test to it.
That's right.
Also,
so I said blood pressure. That was the first one. Cholesterol, your sugar, specifically that A1C.
Yep.
And your BUN and creatinine. That's kidney function.
BUN stand for?
Blood, urea, and nitrogen is what it stands for. And then creatinine is another kidney test. And then the urinalysis, because it'll tell you if you have protein, sugar, ketones, stuff like that. There are some other numbers that you will get on top of that when you get your lab work done. But those are the ones that affect the circle of life where there are no symptoms. So those are the ones that stand out in my mind the most. And in terms of food deserts, that we try to find out where the patients live. So like if they live wherever, Southeast, Northeast, PG County, we try to identify churches that have share programs, because they can go and get food free. They don't have to pay a dime. They get transportation and get to the church. And because our church, Fort Foote Baptist Church, is a share provider. So we try to let them know where they can go and pick up food for free. I mean, things like that. That's real news you can use, real stuff, practical stuff.
And Pennsylvania Avenue also has its food distribution as well. So we are focused on health, to try to have healthy food. Amen. But here's something from Dion Holloway McKinney that says, I gained 61 pounds in 3 months. from June to September. My urine test ruled out any thyroid condition. Should I take other tests? I already have high blood pressure and don't need to add this. Now, I know I was overeating vanilla ice cream, but not at a 20-pound per month clip. I get it, because I love me some cake and some vanilla ice cream. What?
You said what?
Well, if I could just,
what should happen, Dr. Callen, Dr. Melancon?
Well, I'll just say, when you see people gain that much weight that fast, I mean, it could just be overeating, but usually there's a fluid component. And so, and again, there's those two pumps, the heart and the kidneys. So she definitely needs a blood test to look at her kidney function, because if her kidney function is not good, well, then that's your answer. You're developing kidney failure, and that can make you gain a lot of weight very fast. And the other thing would be the heart. So she needs to look at the heart function. If both those things are okay, if her heart functions good and her kidneys are fine, then the next major organ to look for on that circle of life is, of course, the liver, because the liver can also make you gain a lot of weight, right, if you have liver dysfunction. So those are the three big ones, and then if you rule all that out, then we're just talking about good old fashioned fat, and then I love vanilla ice cream as well, but 20 pounds a month is not, that's just too much vanilla ice cream.
Yeah. And I when I hear my wife talk about, anything that says fat free, she said, you better watch it because it's free fat.
Exactly. She's right. She's right. And I know your wife, and I know she's a brilliant woman, and she's right about that.
Yep. So I want you all to understand, please put additional questions in, but we're just about out of time. I do want to say, we got into some social determinants, and maybe we can unpack that a little bit later, because of the fact that we are dealing with some very serious issues. I want to thank you, Dr. Craig, for your wonderful presentation of just telling us, get a physical exam and know our numbers. And we like to be able to share this broadcast and share it widely, so that others will be able to understand that all things matter and are connected. And when we talk about that cycle of life, I hope you are able to just put that up, and they'll say that they first saw it here.
Yes.
They first saw it here, and we'll be able to then add a little kidney and liver down at the bottom.
Okay.
Between the heart and the lungs, and we'll make sure that all of that happens. And Dr. Melancon, Dr. Callender will be happy. And we'll talk about the full filtration and the pumps and all of the other things that we need. And I'm just excited about what you've shared, because it's not being shared too many places. Most of us don't know the numbers. So we want to say thank you, Dr. Craig. And I just want to ask, are there any closing comments that you would have, Dr. Craig, Dr. Callender, and certainly Dr. Melancon?
I just want to say, again, thank you so much for asking me. I don't know. Mr. Brooks was one of my buddies when I was at Howard. I was a medical student. Mr. Brooks was the vice president of, I can't remember what department it was, but Mr. Brooks heard me sing at a Smoker at school. And I sang at every talent show after that until I left Howard, right? Mr. Brooks had me singing. So that's how I met him. And Mr. Brooks told Suna about me. And so I think that's how I got connected. But I just praise God for the connection, however it happened. Dr. Melancon, I must have your cookbook. I know you have some recipes that I want to get a hold of, buddy. So I want to get a hold of them. And Dr. Callender, I don't care what they say about you, that you are partially responsible for the compassionate and successful primary care physician that I am, as are all my other mentors at Howard University. And Reverend Curry, I'm sure I'll be back at your church at some point or time or another.
Yeah, I was just at your church for your church anniversary, the morning service, but we'll see you all again shortly. And we're all in the DMV. For those that want to know, that's DC, Maryland, Virginia. And we're just excited about these kidney talks with the Ron and Joy Paul Kidney Center, George Washington University. You have Dr. Melanson, who is the chief transplant surgeon there. And you have Dr. Callender, who is from the Minority Organ Tissue and Transplant Education Program, MOTEP. And certainly we have the dynamic and awesome Dr. Craig, who is just been awesome today. And she's with Platinum Healthcare, is in Ward 7.
Yes, sir.
And it's in the District of Columbia. And we're so excited that it's over off Minnesota Avenue. And we're just looking forward to much more work. Thank you all for just joining us. Thank you for chiming in and sharing your wisdom. And we are looking forward to seeing you again. Have a wonderful day. Be blessed and take care of those temples that God made for you.
Amen.
Amen. Amen.